Hello everyone, welcome to my channel. This video is about fibromyalgia, which is a chronic pain disorder. I will discuss its symptoms, criteria, causes, diagnosis, and treatment options. Fibromyalgia is a disorder which is characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Fibromyalgia amplifies the painful sensation by affecting the way your brain and spinal cord process the painful and non-painful signals. The primary symptoms of fibromyalgia include widespread pain. The pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. Second is fatigue. People with fibromyalgia often awaken tired, even though they report sleeping for long periods of time. Then is the sleep disturbance. Sleep is often disturbed by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. Next is cognitive difficulties. A symptom commonly referred to as fibrofog is present in these patients. This impairs the ability to focus, pay attention, and concentrate on the mental task. Now, fibromyalgia often coexists with other conditions such as irritable bowel syndrome, chronic fatigue syndrome, migraine and tension headaches, interstitial cystitis or painful bladder syndrome, temporomandibular joint disorders, anxiety, depression, or postural tachycardia syndrome. Now, experts do not fully understand what causes the chronic widespread nature of the fibromyalgia pain. One suggested theory is that the brain lowers the pain threshold. Sensations that were not painful before become very painful over time. Another theory is that the brain and the nerves may misinterpret or overreact to the normal pain signals. They become more sensitive to the point where they cause unnecessary or exaggerated pain. This may be due to a chemical imbalance in the brain or an abnormality in the dorsal root ganglion, which is a cluster of neurons in the spine. There are likely many factors that lead to these changes, including genetics. Because fibromyalgia tends to run in families, there may be certain genetic mutation that may make you more susceptible to developing this disorder. Second is infection. A past illness could trigger fibromyalgia or make its symptoms worse. Infections that have possible link to fibromyalgia include flu, pneumonia, Epstein-Barr virus, gastrointestinal infection such as those caused by the bacteria Salmonella and Shigella. Then fibromyalgia can sometimes be triggered by a physical event such as a car accident. Similarly, prolonged psychological stress may also trigger this condition. Now, what are the risk factors for fibromyalgia? These include number 1, sex. Fibromyalgia is diagnosed more often in the woman than in the man. Then is the family history. You may be more likely to develop fibromyalgia if a parent or sibling also has this condition. Again, if you have osteoarthritis, rheumatoid arthritis, or systemic lupus erythematosus, you may be more likely to develop fibromyalgia. Now, the pain, fatigue, and poor sleep quality associated with fibromyalgia can interfere with your ability to function at home or on the job. The frustration of dealing with an often misunderstood condition also can result in depression and health-related anxiety. Now, the diagnosis. In the past, in order to diagnose fibromyalgia, doctors would check 18 specific points on a person's body to see how many of them were painful when they were pressed firmly. But newer guidelines from the American College of Rheumatology don't require a tender point examination. Instead, the main factor needed for a fibromyalgia diagnosis is widespread pain throughout your body for at least 3 months. To meet the criteria, you must have pain in at least 4 of these 5 areas. First is left upper region, including shoulder, arm, or jaw. Second is right upper region, including shoulder, arm, or jaw. Third is left lower region, including hip, buttock, or leg. Similarly, right lower region, including hip, buttock, or leg. And the last is axial region, which include neck, back, chest, or abdomen. Now, fibromyalgia is a diagnosis of exclusion, and patient must be thoroughly evaluated for the presence of other disorders that could be the cause of the symptoms. These disorders include hypothyroidism, rheumatoid arthritis, systemic lupus erythematosus, polymyalgia rheumatica, other inflammatory or autoimmune disorders, and serious cardiac condition in those with chest pain, dyspnea, and palpitations. Although patients with fibromyalgia do not have characteristics or consistent abnormalities on the laboratory testing, routine laboratory and imaging studies can help to rule out diseases with similar manifestation. And this also assists in diagnosis of certain inflammatory diseases that frequently coexist with fibromyalgia. Now, such tests include the following: complete blood cell count with differential, metabolic panel, urinalysis, thyroid stimulating hormone level, 25-hydroxy vitamin D level, vitamin B12 level, iron studies including iron level, total iron binding capacity, percent saturation, and serum ferritin level, magnesium level, ESR, anti-polymer antibody assay. About 50% of the fibromyalgia patients have anti-polymer antibodies. Then cyclic citrullinated peptide test, rheumatoid factor, anti-nuclear antibody, celiac serology, and if there is a chance that you may be suffering from sleep apnea, then your doctor may recommend an overnight sleep study. Now, in general, treatment for fibromyalgia include both medication and self-care strategies. The emphasis is on minimizing symptoms and improving general health. Now, no one treatment works for all the symptoms, but trying a variety of treatment strategies can have a cumulative effect. First is the medication. These can help reduce the pain of fibromyalgia and also improve sleep. Common choices include pain relievers such as acetaminophen, ibuprofen, naproxen sodium may also be helpful. Now, opioid medication are not recommended because they can lead to significant side effects and dependence, and they will also worsen the pain over time. Second is antidepressant. Duloxetine and milnacipran may help ease the pain and fatigue associated with fibromyalgia. Your doctor may also prescribe amitriptyline or the muscle relaxant cyclobenzaprine to help promote sleep. Next is anti-seizure drugs. Medication designed to treat epilepsy are often useful in reducing certain types of pain. Gabapentin is sometimes helpful in reducing fibromyalgia symptoms, while pregabalin was the first drug approved by the Food and Drug Administration to treat fibromyalgia. Second treatment option is therapies. A variety of different therapies can help reduce the effect that fibromyalgia has on your body and your life. Examples include physical therapy. A physical therapist can teach you exercises that will improve your strength, flexibility, and stamina. Water-based exercises might be particularly helpful. Second is occupational therapy. An occupational therapist can help you make adjustment to your work area or the way you perform certain tasks that will cause less stress on your body. Third is counseling. Talking with a counselor can help strengthen your belief in your abilities and teach you strategies for dealing with stressful situations. Fourth is cognitive behavior therapy or CBT. The basis of this is about helping people set realistic goals. Patients work on identifying dysfunctional thought patterns and developing techniques to manage negative thoughts. The techniques you learn through CBT can help to reduce or minimize your fibromyalgia pain. Third option is lifestyle and home remedies. Self-care is critical in the management of fibromyalgia. First is stress management. Develop a plan to avoid or limit overexertion and emotional stress. Allow yourself time each day to relax. That may mean learning how to say no without guilt. Try not to change your routine completely. People who quit work or drop all activity tend to do worse than do those who remain active. Try stress management techniques such as deep breathing exercises or meditation. Next is sleep hygiene. Because fatigue is one of the main components of fibromyalgia, getting good quality sleep is essential. In addition to allotting enough time for sleep, practice good sleep habits such as going to bed and getting up at the same time each day and limiting daytime napping. Third, exercise regularly. At first, exercise may increase your pain, but doing it gradually and regularly often decreases symptoms. Appropriate exercises may include walking, swimming, biking, and water aerobics. A physical therapist can help you develop a home exercise program. Stretching, good posture, and relaxation exercises are also helpful. Then pace yourself. Keep your activity on an even level. If you do too much on your good days, you may have more bad days. Moderation means not overdoing it on your good days, but likewise it means not self-limiting or doing too little on the days when symptoms flare. Fifth is maintain a healthy lifestyle. Eat healthy foods. Do not use tobacco products. Limit your caffeine intake. Do something that you find enjoyable and fulfilling every day. Now, fourth treatment option for fibromyalgia is alternative medicine. Complementary and alternative therapies for pain and stress management aren't new. Some, such as medication and yoga, have been practiced for thousands of years, but their use has become more popular in recent years, especially with people who have chronic illness such as fibromyalgia. Several of these treatments do appear to safely relieve stress and reduce pain, and some are gaining acceptance in mainstream medicine. But many practices remain unproved because they haven't been adequately studied. One such treatment is acupuncture. It is a Chinese medical system based on restoring normal balance of life forces by inserting very fine needles through the skin to various depths. According to Western theories of acupuncture, the needles cause change in the blood flow and levels of neurotransmitter in the brain and spinal cord. Some studies indicate that acupuncture helps relieve fibromyalgia symptoms, while others show no benefit. Second alternative treatment is massage therapy. This is one of the oldest methods of healthcare still in practice. It involves the use of different manipulative techniques to move your body muscles and soft tissues. Massage can reduce your heart rate, relax your muscles, improve range of motion in your joints, and increase production of your body's natural painkillers. It often helps relieve stress and anxiety. Then is the yoga and tai chi. These practices combine meditation, slow movements, deep breathing, and relaxation. Both have been found to be helpful in controlling fibromyalgia symptoms. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.